The clock on the hospital wall showed 7:30 p.m. when the evening shift began at Riverside Medical Center. It was a Tuesday in March, and the weather outside was getting worse by the hour. Rain was hitting the windows hard, and the wind was making strange noises through the building. Most people would want to stay home on a night like this, but for the medical staff, work never stopped. 3 nurses walked through the main entrance together, shaking off their wet coats and laughing about something one of them had said in the parking lot. They had been working together for almost 2 years now, and everyone at the hospital knew them as the best team on the night shift. The first nurse, Lisa, was known for her quick thinking and calm attitude during emergencies. The second, Anna, always made patients smile with her warm personality and gentle care. The third, Rebecca, was the organized one who never forgot a single detail about any patient's treatment. The trio made their way to the nurses' station on the 4th floor, which was the cardiac unit. This was where they spent most of their time, taking care of patients with heart problems. The day shift nurses were getting ready to leave, and they looked tired after dealing with a busy day. One of them mentioned that room 412 had a new patient who came in during the afternoon with chest pains. Another said that the patient in room 405 was asking for more pain medication, but the doctor hadn't approved it yet. Lisa, Anna, and Rebecca listened carefully to all the updates about their patients. They always took this handover process seriously, because they knew that missing even small details could be dangerous for the people they were taking care of. After the day shift nurses left, the 3 friends began their usual routine of checking on each patient, reading their charts, and making sure all the medications were ready for the night. Everything seemed normal at first. The patients were settling in for the night, and the unit was quieter than usual. Lisa was helping an elderly man in room 403 who couldn't sleep because he was worried about his heart surgery scheduled for the next morning. She sat with him for a few minutes, explaining what would happen and reassuring him that his surgeon was one of the best in the city. Anna was in room 408, carefully checking the 4-line of a woman who had been admitted after a heart attack. Rebecca was at the nurse's station, organizing the medication schedule for the entire night shift. Around 9:15 p.m., something changed. Rebecca noticed that there was a problem with the computer system that handled patient records. Some of the information wasn't showing up correctly, and she couldn't access the medication orders for 3 of their patients. She called the IT department, but they said it might take a while to fix the issue. This kind of technical problem happened sometimes, but it always made the nurses nervous because they needed to have accurate information about every patient. Lisa and Anna came back to the nurses' station to help Rebecca figure out what to do about the computer problem. They decided to check the backup paper records that were kept in a locked cabinet behind the main desk. While they were looking through the files, Anna found something that didn't make sense. There were 2 different versions of the same patient's chart, and the information on them was completely different. The 3 nurses looked at each other with confusion. One chart showed that a patient had received a certain heart medication at 2 p.m., but the other chart said the same patient had received a completely different medication at the same time. This wasn't just a small mistake. It was the kind of error that could seriously hurt someone if the wrong medication was given. Rebecca suggested that they should report this to the supervisor right away. But when they tried to call, nobody answered. The night supervisor was supposed to be in the building, but his office was empty when they went to check. Lisa thought they should call the doctor who was on duty, but Anna pointed out that he was currently in surgery and couldn't be disturbed. Unless it was a life-threatening emergency. As the 3 nurses stood there trying to decide what to do, they started looking more carefully at other patient files. What they found made them feel sick to their stomachs. There were more charts with conflicting information, medication orders that had been changed without proper authorization, and signatures that looked like they might have been forged. It was becoming clear that something very wrong was happening. At their hospital. By 10:30 p.m., the 3 friends had discovered at least 7 different cases where patient records had been altered or falsified. Some of the changes were small, like adjusting the time when a medication was given. But others were much more serious, like completely changing what treatment a patient had received, or hiding the fact that someone had experienced a dangerous reaction to a medication. Anna was the first one to say what they were all thinking. Someone was deliberately changing patient records to cover up mistakes or hide problems. This wasn't just poor record keeping or honest errors, it was systematic and intentional. Lisa felt her hands shaking as she realized that patients could have died because of these cover-ups, and nobody would ever know the real reason why. Rebecca was always the practical one in their group, and she suggested that they needed to document everything they had found before telling anyone else about it. She was worried that if they just reported it verbally, someone might claim they were making it up or that they had misunderstood what they were seeing. They decided to use Rebecca's phone to take pictures of the conflicting charts and make notes about everything they had discovered. For the next hour, the three nurses worked together to carefully document all the evidence they had found. They took photos of dozens of patient charts, making sure to capture the original information and the changes that had been made. They wrote down the names of the patients involved, the dates when the records had been altered, and details about what kind of changes had been made. As they worked, they began to notice a pattern. Most of the altered records involved patients who had experienced complications or unexpected problems during their treatment. In every case, the changes made, it looked like the hospital staff had followed proper procedures and that any bad outcomes were unavoidable. But the original records told a different story, one of mistakes, oversights, and preventable problems that had been covered up. At 11:45 p.m., the three nurses finished documenting everything they had found. They had over 50 photos and several pages of handwritten notes. Rebecca suggested that they should put all the evidence in a safe place before deciding how to report what they had discovered. She had a small storage locker in the basement of the hospital where she sometimes kept personal items, and she thought it would be secure there until they could figure out the best way to handle the situation. Lisa and Anna agreed that this was a good plan. They were all feeling overwhelmed by what they had discovered, and they needed time to think about the best way to make sure the information got to the right people. They also realized that whoever was responsible for changing the records probably had a lot of power at the hospital, and they needed to be careful about how they proceeded. The three friends took the elevator down to the basement level, where the employee storage lockers were located. The basement was always quiet and a little creepy at night, with dim lighting and the constant humming of the hospital's mechanical systems. Rebecca led the way to her locker, which was in a corner area. That was rarely used by other staff members. They never made it back to the fourth floor that night. When morning came, the day shift nurses arrived at Riverside Medical Center expecting to receive their usual handover report from the night team. But instead of finding Lisa, Anna, and Rebecca ready to update them on patient care, they found an empty nurses' station and confused patients. Asking where their night nurses had gone, the first person to realize something was seriously wrong was Patricia, a veteran nurse who had been working at the hospital for 15 years. She immediately checked the staff break room, thinking maybe the three women were having a late coffee together. When she didn't find them there, she went to the employee parking lot to see if their cars were still there. All three vehicles were exactly where they had been parked the night before, untouched and covered with morning dew. Patricia's heart started beating faster as she walked back into the hospital. She had worked with Lisa, Anna, and Rebecca long enough to know that they would never just abandon their patients without telling anyone. These were dedicated professionals who took their responsibilities seriously. Something had to be very wrong. For them to simply disappear like this, the hospital's security office was located on the first floor, next to the main entrance. Patricia hurried there and found the night security guard, Tom, who was getting ready to finish his shift. When she told him about the missing nurses, Tom looked confused and said he hadn't seen anything unusual during the night. He checked his logbook and confirmed that all three nurses had entered the building at their normal time, but there was no record of them leaving. Within an hour, the hospital administration was involved. The CEO, Dr. Hamilton, arrived earlier than usual after receiving an urgent phone call about the situation. He immediately ordered a complete search of the building, involving security guards, maintenance staff, and available medical personnel. They checked every floor, every room, every storage area, and every possible place where 3 people might be found. The search revealed some puzzling details. In the basement near the employee lockers, security found Rebecca's phone lying on the floor with a cracked screen. There were no other signs of struggle or disturbance in the area, just the damaged phone that looked like it had been dropped or thrown. The locker that Rebecca had been heading toward was still locked, and when they opened it, they found only some old textbooks and a spare uniform. By noon, Dr. Hamilton made the decision to contact the police. This wasn't the kind of situation the hospital could handle internally, especially with 3 employees missing and no reasonable explanation for their disappearance. The local police department sent Detective Rodriguez, an experienced investigator who specialized in missing persons cases. Detective Rodriguez was a practical woman in her early 40s who had seen enough strange cases to know that the truth was often more complicated than it first appeared. When she arrived at Riverside Medical Center, she immediately began interviewing everyone who had worked with the 3 missing nurses. She set up a temporary office in one of the hospital's conference rooms and started calling in staff members one by one. The interviews revealed that Lisa, Anna, and Rebecca had been acting differently in the weeks leading up to their disappearance. Several colleagues mentioned that the 3 women had been having quiet conversations that stopped whenever other people came near. A few staff members had noticed them staying late after their shifts, sometimes meeting in the hospital cafeteria or in empty patient rooms to talk about something that seemed very serious. One particularly interesting witness was Dr. Peterson, a cardiologist who worked closely with the nursing staff on the 4th floor. He told Detective Rodriguez that about 2 weeks before the disappearance, Rebecca had asked him some unusual questions about patient record-keeping procedures. She wanted to know who had access to electronic medical records, how changes were tracked in the computer system, and what protocols existed for reporting discrepancies in patient charts. Dr. Peterson had thought Rebecca's questions were related to a quality improvement project or some kind of training exercise. But looking back, he realized that she had seemed nervous and concerned when asking these questions, not curious in the way someone would be if they were just trying to learn more about hospital procedures. Another witness who provided important information was Janet, a clerk who worked in the medical records department. She remembered that Anna had come to her office several times in recent weeks, asking to see original paper charts for patients who had been treated months earlier. Anna had claimed she was doing research for a presentation, but Janet thought it was odd because nurses usually didn't need access to old records, unless there was a specific medical reason. Detective Rodriguez also discovered that the hospital's computer system had experienced several unusual problems in the weeks before the nurses disappeared. The IT department reported multiple instances of someone trying to access restricted areas of the electronic medical record system, often during night shifts when fewer people were around to notice the activity. The attempted access had been blocked by security protocols, but the IT staff had been planning to investigate further to identify who was responsible. As the investigation continued, Detective Rodriguez began to focus on the hospital's administration and management structure. She requested access to personnel files, financial records, and any reports of previous incidents or complaints. This was where she encountered her first real obstacle in the case. Dr. Hamilton and several other administrators were reluctant to provide full access to hospital records. They cited patient privacy laws and claimed that releasing certain information could violate confidentiality agreements. When Detective Rodriguez pressed for more cooperation, the hospital's legal team became involved, insisting that any access to sensitive records would require court orders and extensive legal review. This resistance made Detective Rodriguez suspicious. In her experience, innocent organizations were usually eager to cooperate with police investigations, especially when their own employees were missing. The fact that Riverside Medical Center was putting up legal barriers suggested that there might be something in those records that they didn't want discovered while dealing with the hospital's legal obstacles. Detective Rodriguez continued interviewing staff members and investigating the personal lives of the 3 missing nurses. She visited their homes, talked to their families and friends, and tried to understand if there had been any personal problems or threats that might explain their disappearance. Lisa lived in a small apartment near the hospital with her younger sister, who was studying to become a teacher. The sister, Kelly, was devastated by Lisa's disappearance and couldn't understand what had happened. She told Detective Rodriguez that Lisa had seemed stressed in recent weeks but wouldn't talk about what was bothering her at work. Kelly remembered that Lisa had mentioned something about doing the right thing, but hadn't provided any details about what she meant. Anna's family lived in the suburbs, and she had been planning to get married to her longtime boyfriend in the summer. Her fiancé, David, said that Anna had been having trouble sleeping and seemed worried about something at the hospital. She had told him that she and her friends had discovered something important, but she wouldn't explain what it was because she said it needed to stay confidential until they figured out how to handle it properly. Rebecca's situation was the most revealing. She lived alone but was very close to her elderly mother, who lived in a nearby nursing home. When Detective Rodriguez visited Rebecca's apartment, she found that it had been thoroughly cleaned and organized, as if Rebecca had been preparing for something. There were no personal computers or electronic devices in the apartment, which seemed unusual for someone who worked in a modern hospital environment. The investigation was entering its third week when Detective Rodriguez received a call that would change everything. A construction worker at a development site about 20 miles from the hospital had found something buried in a pile of old concrete and debris. It was a hospital ID badge belonging to one of the missing nurses. The hospital ID badge found at the construction site belonged to Anna, and it changed everything about the investigation. Detective Rodriguez knew that finding personal items far from where someone disappeared usually meant one of two things. Either the person had traveled there voluntarily, or someone else had taken them there. Given that Anna's car was still in the hospital parking lot and there were no signs she had left willingly, the second option seemed much more likely. The construction site was part of a new shopping complex being built on the outskirts of town. The area had been under development for several months, with heavy machinery moving dirt and concrete almost every day. If someone wanted to hide evidence, this would be an ideal location because the constant construction activity would quickly cover up anything that was buried there. Detective Rodriguez immediately ordered a complete search of the construction site. The work had to be done carefully because any evidence that might be buried there could easily be destroyed by heavy equipment. She brought in specialized teams with ground-penetrating radar and cadaver dogs to help locate anything that might have been hidden in the area. While the search was happening at the construction site, Detective Rodriguez decided to take a closer look at the personal belongings of the three missing nurses. She had already been through their homes, but now she was searching for anything that might explain why Anna's ID badge had ended up 20 miles away from the hospital. Rebecca's apartment was the most puzzling. As Detective Rodriguez had noticed before, it was unusually clean and organized, but this time she looked more carefully at what wasn't there. For someone who worked with computers every day at the hospital, Rebecca had no personal laptop, no tablet, and no external storage devices anywhere in her home. This seemed strange for a nurse who would likely need to access work-related information or continuing education materials online. Detective Rodriguez called Rebecca's mother at the nursing home where she lived. The elderly woman was confused and worried about her daughter's disappearance, but she provided some important information. She said that Rebecca had visited her about 2 weeks before she went missing, and during that visit she had given her mother a small package to keep safe. Rebecca had told her mother it was important paperwork and asked her to hide it somewhere secure until Rebecca came back for it. When Detective Rodriguez arrived at the nursing home, Rebecca's mother led her to a small safe in her room where she kept her most valuable possessions. Inside the safe, wrapped in plastic bags, was a USB drive and several printed documents. Rebecca's mother said her daughter had been very serious when she gave her these items, and she had made her promise not to tell anyone about them unless something happened to Rebecca. Back at the police station, Detective Rodriguez connected the USB drive to a secure computer that wasn't connected to the internet. What she found on that drive made her understand why 3 dedicated nurses had suddenly disappeared. The USB contained hundreds of photos of patient medical records, detailed written notes about discrepancies in hospital documentation, and a timeline showing a pattern of cover-ups that had been going on for over a year. The evidence was methodically organized, showing that Lisa Anna and Rebecca had been secretly investigating problems at Riverside Medical Center for months. They had discovered that patient charts were being routinely altered after serious complications or unexpected deaths occurred. In many cases, the original records showed that hospital staff had made mistakes or failed to follow proper procedures. But the altered versions made it appear that everything had been done correctly. One particularly disturbing case involved an elderly patient who had died after receiving the wrong medication. The original chart clearly showed that a nurse had administered a drug that the patient was allergic to, information that was clearly marked in the patient's file. But the altered version of the chart had been changed to show that the patient had received the correct medication and had died from unexpected complications related to his underlying heart condition. Another case showed a patient who had developed a serious infection after surgery. The original surgical notes indicated that proper sterilization procedures had not been followed, and that the operating room had not been properly cleaned between surgeries. The altered version claimed that the infection was caused by the patient's compromised immune system and was unavoidable despite all proper precautions being taken. As Detective Rodriguez read through the evidence, she realized that the 3 nurses had uncovered a systematic effort to hide medical errors and protect the hospital from malpractice lawsuits. The financial implications were enormous. Each covered-up case could have resulted in millions of dollars in legal settlements if the truth had been discovered by patients, families, or medical malpractice attorneys. The USB drive also contained audio recordings that the nurses had made using their phones. In these recordings, they discussed their growing concern about what they were discovering and their debates about what they should do with the information. It was clear from their conversations that they knew they were taking a serious risk by investigating these problems, but they felt a moral obligation to protect future patients from preventable harm. In one recording, Lisa could be heard saying that she couldn't sleep at night knowing that families had lost loved ones due to preventable mistakes, and that those families would never know the truth about what had really happened. Anna talked about how she had become a nurse to help people, and she couldn't continue working at a place where patient safety was being sacrificed to protect the hospital's reputation. Rebecca's voice on the recording showed her practical approach to the situation. She was the one who had suggested documenting everything carefully before taking any action. She knew that without solid evidence, their allegations would be dismissed as the complaints of disgruntled employees. She also expressed concern about the powerful people who would be threatened by their discoveries and warned her friends that they needed to be careful about how they proceeded. The final recording on the USB drive was made just 2 days before the nurses disappeared. In this conversation, the 3 women discussed their plan to meet with a patient safety advocate and a journalist who specialized in healthcare investigations. They had decided that the evidence they had gathered was too important to keep within the hospital's internal reporting system, where it could be buried or ignored by the same people who were responsible for the cover-ups. Detective Rodriguez also found contact information for the journalist and the patient safety advocate that the nurses had planned to meet. When she called them, both confirmed that they had been scheduled to meet with 3 nurses from Riverside Medical Center, but the nurses had never shown up for their appointments. The journalist said that the nurses had told him they had evidence of serious problems at their hospital, but had been vague about the details during their initial phone conversations. The printed documents that Rebecca had left with her mother included copies of the altered medical records and detailed notes about how the changes had been made. The nurses had discovered that the alterations were being done through the hospital's computer system by someone with high-level access privileges. The changes were made carefully to look like routine updates or corrections, but the patterns showed that they were all designed to hide evidence of medical errors. One document showed a list of hospital administrators and doctors who had access to the computer system and could make the kinds of changes that the nurses had documented. At the top of that list was Dr. Hamilton, the hospital CEO, along with several other senior executives and the head of the medical records department. Detective Rodriguez realized that the three nurses had been planning to expose a conspiracy that went to the very top of the hospital's leadership. They had gathered evidence that could destroy careers, result in criminal charges, and cost the hospital millions of dollars in lawsuits and penalties. With stakes that high, it was becoming clear why three dedicated nurses might suddenly disappear. Without a trace, the search at the construction site was still ongoing, but Detective Rodriguez now had a much clearer picture of why Lisa, Anna, and Rebecca had vanished, and who might be responsible for their disappearance. Armed with the evidence from the USB drive, Detective Rodriguez knew she was dealing with something much bigger than a simple missing persons case. The three nurses had uncovered a conspiracy that involved some of the most powerful people at Riverside Medical Center, and now she had to be extremely careful about how she proceeded. One wrong move could alert the people responsible and give them a chance to destroy more evidence or cover their tracks even deeper. The first thing Detective Rodriguez did was contact her supervisor, Captain Williams, to brief him on what she had discovered. Captain Williams was a veteran police officer who had seen his share of corruption cases, but even he was shocked by the scope of what the nurses had documented. He immediately assigned additional detectives to work with Rodriguez and arranged for the case to be handled with the highest level of security to prevent any leaks that might warn the suspects. Detective Rodriguez decided to start her investigation by looking into Dr. Hamilton's background and history. What she found was disturbing but not entirely surprising. Before coming to Riverside Medical Center 3 years earlier, Dr. Hamilton had worked at 2 other hospitals in different states. When Rodriguez contacted police departments in those areas, she learned that both hospitals had experienced similar problems with unexplained staff departures and allegations of cover-ups that had never been fully investigated. At the first hospital in Arizona, a respiratory therapist had made complaints about altered patient records and had been planning to contact state health authorities when he suddenly resigned and moved out of state. His colleagues said he had seemed frightened in his final weeks at the hospital and had mentioned receiving threats about keeping quiet. At the second hospital in Colorado, 2 doctors had died in what was ruled a car accident, but they had been known to be gathering evidence about systematic problems with patient care documentation. The pattern was becoming clear. Dr. Hamilton seemed to move from hospital to hospital, staying long enough to establish control over record-keeping systems and then leaving when problems became too difficult to manage. At each location, people who tried to expose wrongdoing either disappeared, resigned under pressure, or met with unfortunate accidents. While investigating Dr. Hamilton's past, Detective Rodriguez also began looking into the current situation. At Riverside Medical Center, she obtained court orders to access the hospital's computer systems and financial records. Despite strong objections from the hospital's legal team, the digital forensics experts who examined the computer system found exactly what the 3 nurses had suspected: a sophisticated scheme to alter patient records after problems occurred. The computer logs showed that most of the alterations had been made during night shifts when fewer people were around to notice unusual activity. The changes were made using administrative access codes that belonged to Dr. Hamilton and 2 other senior executives. The timing of the alterations was particularly telling. They almost always occurred within 24 to 48 hours after a patient death or serious complication, suggesting that someone was quickly moving to cover up problems before they could be discovered. Detective Rodriguez decided it was time to start interviewing the people who were directly involved in the conspiracy. She began with the head of medical records, Mrs. Thompson, who had worked at the hospital for over 20 years. When Rodriguez first approached her, Mrs. Thompson was nervous and claimed she didn't know anything about altered records or cover-ups, but as the interview continued, Mrs. Thompson's story began to fall apart. Rodriguez showed her specific examples of record alterations from the nurse's evidence, and Mrs. Thompson couldn't explain how such changes could have occurred without her knowledge. Finally, after several hours of questioning, Mrs. Thompson broke down and admitted that she had been pressured by Dr. Hamilton to make changes to patient charts whenever problems occurred. Mrs. Thompson revealed that Dr. Hamilton had threatened her job and pension if she didn't cooperate with his demands. She said she had been uncomfortable with what she was being asked to do, but she was close to retirement and couldn't afford to lose her job. She also admitted that she wasn't the only employee who had been pressured to participate in the cover-ups. The breakthrough came when Mrs. Thompson told Detective Rodriguez about a meeting that had taken place 2 weeks before the nurses disappeared. Dr. Hamilton had called Mrs. Thompson into his office along with the head of security, Mr. Chen, and told them that 3 nurses were asking too many questions about patient records. Dr. Hamilton had said that the nurses were threatening the hospital's reputation and that something needed to be done to stop them before they caused serious damage. Mrs. Thompson said that Dr. Hamilton had asked her to identify all the records that the nurses had accessed and to delete any computer logs that might show their activities. When she expressed concern about destroying evidence, Dr. Hamilton had reminded her that her pension and her family's financial security depended on her continued loyalty to the hospital. Detective Rodriguez immediately brought in Mr. Chen, the head of security, for questioning. Chen was a former police officer who had worked at the hospital for 5 years. Unlike Mrs. Thompson, Chen was not cooperative and demanded to have a lawyer present before answering any questions. This reaction told Rodriguez that Chen probably knew much more about what had happened to the 3 nurses than he was willing to admit. While waiting for Chen's lawyer to arrive, Detective Rodriguez received an urgent call from the construction site where the search was continuing. The specialized teams had found something buried beneath several feet of concrete and debris. It wasn't just Anna's ID badge. They had discovered personal belongings that belonged to all 3 missing nurses, including their name tags, watches, and pieces of their uniforms. The location where the items were found was particularly significant. The construction site belonged to a development company that was owned by Dr. Hamilton's brother-in-law. Detective Rodriguez realized that this family connection probably explained how Dr. Hamilton had access to the site and why he might have chosen it as a place to dispose of evidence. When Chen's lawyer arrived, the attorney immediately tried to limit the scope of the questioning and insisted that his client had done nothing wrong. But Detective Rodriguez had done her homework, and she was able to present Chen with evidence that contradicted his claims of innocence. Phone records showed that Chen had made several calls to Dr. Hamilton on the night the nurses disappeared, and security camera footage from a nearby business showed Chen's personal vehicle leaving the hospital around 2 a.m., which was hours after his shift was supposed to end. Faced with this evidence, Chen's lawyer requested a private conference with his client. After 30 minutes of discussion, they returned with an offer. Chen was willing to provide information about what had happened to the 3 nurses in exchange for a plea agreement that would reduce the charges against him. Chen's confession revealed the full scope of the conspiracy and the tragic fate of Lisa, Anna, and Rebecca. According to Chen, Dr. Hamilton had become increasingly worried about the nurses' investigation in the weeks before their disappearance. The 3 women had been asking questions that were getting too close to the truth, and Dr. Hamilton feared that they would eventually gather enough evidence to expose the entire cover-up operation on the night of their disappearance. Dr. Hamilton had instructed Chen to monitor the nurses' activities and report back on what they were doing. When Chen discovered that the nurses were in the basement area photographing patient records and gathering evidence, he had called Dr. Hamilton immediately. Dr. Hamilton had then ordered Chen to handle the situation before the nurses could leave the hospital with their evidence. Chen admitted that he had confronted the 3 nurses in the basement and tried to convince them to hand over their phones and any evidence they had gathered. When the nurses refused and threatened to call the police, the situation had escalated quickly. Chen claimed that he had only intended to scare them into keeping quiet, but things had gone wrong and all 3 nurses had been seriously injured. During the confrontation, rather than call for medical help, Chun had panicked and called Dr. Hamilton. Together, they had made the decision to cover up what had happened rather than face the consequences of their actions. They had disposed of the nurses' bodies at the construction site and then worked to make it appear that the women had simply vanished without a trace. Detective Rodriguez felt sick as she listened to Chun's confession, but she knew that his testimony was the key to bringing justice for Lisa, Anna, and Rebecca. The three dedicated nurses had paid the ultimate price for trying to protect patients and expose the truth about medical cover-ups at Riverside Medical Center. With Chun's confession in hand, Detective Rodriguez knew she had enough evidence to arrest Dr. Hamilton, but she wanted to be absolutely certain that her case was airtight. The families of Lisa, Anna, and Rebecca deserved justice, and she couldn't afford to let Dr. Hamilton escape on a technicality or because of his powerful connections in the medical community. The search teams at the construction site had been working around the clock, and their efforts finally paid off when they made the discovery that everyone had been dreading but expecting. Buried beneath layers of concrete and construction debris, they found the remains of all three nurses. The evidence confirmed Chun's confession about what had happened that terrible night in the hospital basement. Detective Rodriguez had the difficult task of notifying the families. She drove to each home personally, sitting with Lisa's sister, Kelly, Anna's fiancé David, and Rebecca's elderly mother to deliver the heartbreaking news. The pain in their eyes was something that would stay with Rodriguez for the rest of her career, but she also saw something else, a fierce determination to make sure that the people responsible would pay for what they had done. The arrest of Dr. Hamilton took place early on a Tuesday morning, just as he was arriving at Riverside Medical Center for what he thought would be another normal day of running the hospital. Detective Rodriguez had coordinated with federal authorities because the case now involved multiple states and potential violations of federal healthcare laws. When Dr. Hamilton saw the police cars in the hospital parking lot, he tried to turn around and leave, but officers were waiting for him. Dr. Hamilton maintained his innocence even as he was being handcuffed, claiming that he knew nothing about any missing nurses or altered medical records. But his calm demeanor cracked when Detective Rodriguez told him that Chun had already confessed and provided detailed information about the conspiracy. For the first time since the investigation began, Dr. Hamilton looked genuinely frightened. The news of the arrests spread quickly through Riverside Medical Center and the surrounding community. Hospital employees were shocked to learn about the systematic cover-ups that had been happening right under their noses. Many staff members came forward with information about incidents they had witnessed or suspicious activities they had noticed but hadn't reported because they feared retaliation. One of the most emotional moments came when Dr. Peterson, the cardiologist, who had worked closely with the three nurses, spoke at a press conference. With tears in his eyes, he talked about how Lisa, Anna, and Rebecca had been dedicated professionals who truly cared about their patients. He said that their death was not just a tragedy for their families, but a loss for every patient who would never benefit from their compassionate care. The investigation revealed that the conspiracy at Riverside Medical Center was even larger than anyone had initially suspected. Over the course of 2 years, more than 40 cases of medical errors had been covered up through altered records. These cases involved everything from medication mistakes and surgical complications to infections caused by poor sanitation and equipment failures. Most heartbreaking were the families, who learned that their loved ones had died due to preventable medical errors, not the natural complications they had been told about. Mrs. Anderson, whose husband had died after receiving the wrong heart medication, broke down when she learned that his death could have been prevented if proper procedures had been followed. The family of Mr. Garcia, who had died from a post-surgical infection, discovered that the operating room had not been properly sterilized before his procedure. The legal proceedings that followed were complex and lengthy. Dr. Hamilton was charged with multiple counts of murder, conspiracy, obstruction of justice, and healthcare fraud. Chun faced similar charges for his role in the deaths of the three nurses and the ongoing cover-up. Mrs. Thompson, the medical records director, received a lighter sentence in exchange for her cooperation, but she still faced charges for her participation in the conspiracy. The trial drew national attention as details of the cover-up became public. Medical professionals across the country were horrified to learn about the systematic way that patient safety had been compromised for the sake of protecting the hospital's reputation and avoiding lawsuits. The case sparked new discussions about the need for stronger whistleblower protections for healthcare workers who report safety concerns. During the trial, prosecutors presented the evidence that Lisa, Anna, and Rebecca had so carefully gathered. The USB drive that Rebecca had hidden with her mother became a crucial piece of evidence, showing the dedication and courage of the three nurses who had risked everything to protect future patients. The audio recordings they had made revealed their genuine concern for patient safety and their moral struggle with what they had discovered. Dr. Hamilton's defense team tried to argue that he had been unaware of the record alterations and that Cheung had acted on his own when he confronted the nurses. But the evidence was overwhelming. Computer logs showed that Dr. Hamilton had personally authorized many of the record changes, and phone records proved that he had been in constant communication with Chun. On the night of the murders, the jury deliberated for only 6 hours before returning guilty verdicts on all charges. Dr. Hamilton was sentenced to life in prison without the possibility of parole. Cheung received a sentence of 45 years for his role in the murders and cover-up. The sentences brought some measure of comfort to the families, but nothing could bring back Lisa, Anna, and Rebecca. In the aftermath of the trial, Riverside Medical Center faced enormous legal and financial consequences. The hospital was sued by dozens of families whose loved ones had been affected by the covered-up medical errors. The total settlements exceeded $50 million, and the hospital was forced to operate under federal oversight to ensure that proper patient safety protocols were implemented. The case also led to significant changes in healthcare regulation and oversight. New laws were passed requiring hospitals to have independent patient safety officers who report directly to state health departments rather than to hospital administrators. Electronic medical record systems were redesigned to make it much more difficult to alter records without leaving detailed audit trails. Perhaps most importantly, the case led to stronger protections for healthcare workers who report safety concerns. The law now known as the Lisa, Anna, and Rebecca Act provides federal protection for medical professionals who report patient safety violations and establishes severe penalties for any retaliation against whistleblowers. At Riverside Medical Center, a memorial garden was created in honor of the three nurses who died trying to protect their patients. The garden features 3 benches surrounded by flowers that bloom throughout the year, providing a peaceful place for reflection and remembrance. A plaque in the garden reads, "In memory of 3 heroes who chose courage over comfort and truth over silence." The families of Lisa, Anna, and Rebecca found some comfort in knowing that their loved ones' deaths had not been in vain. The changes that resulted from their sacrifice would protect countless future patients from experiencing preventable harm. Kelly, Lisa's sister, became an advocate for patient safety and often spoke at medical conferences about the importance of supporting healthcare workers who speak up about problems. Anna's fiancé David established a scholarship fund for nursing students who demonstrated exceptional commitment to patient advocacy. Rebecca's mother, despite her advanced age, became involved with patient safety organizations and worked to ensure that other families would never have to experience the pain of losing someone due to medical cover-ups. The story of Lisa, Anna, and Rebecca serves as a powerful reminder that ordinary people can become heroes when they choose to do what's right, even when it's dangerous. Their courage in the face of a powerful conspiracy ultimately saved lives and changed the healthcare system for the better. Though they paid the ultimate price for their dedication to patient safety, their legacy continues to protect patients and inspire healthcare workers to always put patient welfare above all other considerations.